meetings if you have your yellow paper. But even before your yellow paper, and if we ran out of yellow papers, there are a few that have the white and the Rocky Flats Right to Know logo on the bottom. First, a huge thank you to Trinity Presbyterian Church and the pastor here, John Anderson. Without the church allowing us to meet here for no charge, we could not have these meetings. Mary and Whitney and I are the two grandmothers who started Rocky Flats Right to Know, and we feel strongly that we wish to continue as volunteers in our community. However, if you wish to defray the costs to the church for the electricity and etc., please put a donation in the basket that's right outside this door. There are envelopes there too, just to thank Trinity for allowing us to use this church. On a side note there have never been any negative comments to the church for hosting us. So then to the yellow sheet, please note about the Jefferson Parkway Public Highway Authority Board meeting on December 20th at Arvada City Hall. Please attend if you can. There is time for public comment. Please speak about why building a private tollway through contaminated land is not respectful of those who live downwind, not to mention the workers who would build that road. They are searching for a private partner. They're taking bids. I don't know if that's the right word, but they're just going forward. So we need to do all we can to prevent that. We don't need a private tollway. Also note the Westminster and Broomfield Council meetings. Please attend and speak. Westminster can be thanked for their prompt action concerning the proposed fracking. Both Westminster and Broomfield communities have been hugely impacted by Rocky Flats over the years. So consider them your allies when asking Westminster for adequate signage at Westminster Hills open space. And Broomfield, ask them to stop the Jefferson Parkway. They're one of the trio of City of Arvada, $200,000 a year in taxpayer money. Jefferson County, $200,000 a year in taxpayer money, and same with City and County of Broomfield. And that's for 10 years. That's $6 million already spent in taxpayer money towards a private toll road where no testing is required since it's private. Please speak out. And of course, a huge thank you to the town of Superior for their actions, quick actions regarding the proposed fracking. Lastly, there's a sign up in the back. If you're not on the email list, you can sign up there. Also, sign up if you're interested in helping with Rocky Flats film series. We possibly are thinking of calling it Atomic Amnesia. So now, to introduce Dr. Mark Johnson. As I read his bio, I printed out a few. I think we ran out. I'm not going to read his complete bio, but notice how many times it says the word preventative occurs. That's the best kind of health care. Dr. Mark Johnson has been the Executive Director of the Jefferson County Department of Health and Environment since April 1990. He was raised in Grand Junction, Colorado, and attended Campion Academy in Loveland, Colorado, Pacific Union College in Northern California, and medical school at Loma Linda University in Southern California. He served for 3 years as a commissioned officer in the U.S. Public Health Service and was discharged as a lieutenant colonel after serving for 7 years in the Army Reserves. Dr. Johnson received his medical specialty training and Master's of Public Health degree at Johns Hopkins University in Baltimore, Maryland, and became board certified in preventive medicine and public health in 1988. He served as the medical director for the Center of Health Promotion at Loma Linda University, then as the director for preventive medicine services and state epidemiologist in Wyoming before moving back to Colorado in 1990. He currently serves on the residency advisory committees for the Dartmouth-Hitchcock Leadership Preventive Medicine Program and the University of Colorado Preventive Medicine Residency. Please welcome Dr. Mark Johnson.
Thank you very much. I'm honored to be here. I was not expecting such a big crowd. I thought we would have a very small group. We could sit around and have a very informal discussion. So I don't have a formal presentation, but I want to talk to you a little bit about being the health officer here in Jefferson County and some of my thoughts about the history of Rocky Flats and the history of Jefferson County Public Health Department and its work around Rocky Flats. As was mentioned, I did my specialty training at Johns Hopkins, and the director of our residency had just been fired by the state of Vermont as the health officer in Vermont. And one of the things he told us was, if you work in public health, if you don't get fired, you're not doing your job. Also, I want to read to you from one of the presentations that Dr. Carl Johnson, one of my predecessors, said in a public health, a speech to the American Public Health Association back in 1985. He said, "The mission of protecting and promoting the health of people in the community often places the health officer at cross purposes with powerful business, industrial, or political interests. The usual outcome is a new, more tractable health officer or administrator. That is, a good health officer must find a new position every 5 years. I have been in my position now for 28 years, which means I'm doing something wrong. I will say, however, that I did make the governor very angry with me, and that has to some degree stifled some of my work in Colorado, so at least I'm trying to make people angry. I grew up in Grand Junction, and my school was built on the mine tailings from uranium mines in Uravan and Nukla. And we used to get sand to build things in around our house that had these beautiful purple pieces that almost glowed in the dark. And later we found out that this was mine tailings also from uranium mines. And many of you may know that Grand Junction has an increased rate of leukemia and other cancers for people who live over there. So I do have some history of what's going on with living around nuclear waste. Also, as I have mentioned in one of the articles or one of the pieces I wrote for the Denver Post, my father was supposed to be in the first wave of soldiers going into Japan, was waiting in the ships when the bomb blew off in Hiroshima and then later in Nagasaki, and has told me all my life, if it wasn't for atomic weapons, Mark, you never would have been here. They had been told by their officers that they expected there would be about 1 million casualties from people going in to try to conquer Japan, and that the first wave would probably be completely wiped out. So I've grown up with this sort of ambivalence or different ways of looking at nuclear weapons and the nuclear work. But it didn't really get personal to me until I took the job here in Jefferson County. In 1990, I started in April. Many of you know the history of Rocky Flats as well or better than I do. I see Randy Stafford in the group. He probably knows more about Rocky Flats than anybody I've met. And as I came into Jefferson County, they were just starting to do some of the grand jury had just been put together to look at Rocky Flats. There had just been the raid of Rocky Flats in 1989. And they were starting to put together community groups to study what was going on. And we applied for me to be on one of those groups. We were told that it was not necessary for me to be on that group. They already had enough people. We have tried 4 or 5 times since then to get onto various commissions or to do things, and have always been told that the county really did not have standing with Rocky Flats, that this was a problem for the state health department and the federal agencies to deal with, and thank you very much, but we don't want Jefferson County to be represented on these groups. I blame Dr. Carl Johnson for that, and many of you may know Dr. Carl Johnson's history, but let me tell you just a little bit about it for those of you who may not know him. He was the health officer in Jefferson County, began in 1975, and was very interested in what was going on in Rocky Flats. He's the one I just quoted from, saying if you don't get fired every 5 years, you're not doing your job. He took on a number of special interest groups. He took on the realtors, he took on the asbestos pipe makers, he took on Rocky Flats, he took on there was a company that was making on-site wastewater systems for in the mountains that he felt were ineffective. So he was making enemies with the industries all around in Jefferson County, but really got into trouble when he became concerned with Rocky Flats. He was asked by one of the county commissioners to review whether a property near Rocky Flats should be allowed to build houses or not, and as he reviewed and did some studies, became convinced that there was contamination that had come off of Rocky Flats and was in this property, and that it was not a good idea for them to build houses in this property. The state health department had already approved it, and the county commissioners were about ready to approve it when he went before them, gave them the information that he had, and they decided not to allow the building of the houses on that property. The property owners sued, saying no longer could build on it. Unfortunately for Dr. Johnson, the president of the Board of Health, his direct boss, also owned about 20 acres very close to Rocky Flats, and was very upset that this was decreasing the value of his property. The county commissioners, there was a change in the county commissioners, some real estate developers and a realtor were put onto the county commission, and they, working with the president of the Jefferson County Board of Health, decided to ask Dr. Johnson to resign. Dr. Johnson refused, and essentially it's a long story, but to take the short route, he basically said he would not resign, and the county commissioners fired him. Reading through the state statutes, he recognized that the county commissioners were not his bosses, the Board of Health were his bosses, and only the Board of Health could hire or fire him. So he fought them all the way to the state Supreme Court, saying, I have been fired by the county commissioners, they cannot fire me, and he won that battle. And that actually, if you go through the public health statutes in Colorado, you'll see numerous notations underneath footnotes talking about Jefferson versus Johnson, or Johnson versus Jefferson County. A lot of people think that was me. It was not I. It was Dr. Carl Johnson. Also, I am not related at all to Dr. Carl Johnson. Some people have confused that. So he was told by the state Supreme Court that they could not fire him. He went back, and the Board of Health fired him. Essentially. Basically, they came to an agreement where he would leave if he was paid to leave, and they essentially fired him. So when I started my job here, I read through a number of the articles that he had written. I read through the speech that he had given to the American Public Health Association, and I was very interested in what was going on at Rocky Flats because of the raid that had just taken place and all of the committees that were looking into this and the work of the grand jury that was going on at that time. As I had mentioned earlier, we were told that we were not wanted really at most of those committee meetings. They finally did allow me to come as a visitor to some of those meetings, and we did try to find out what was going on, try to learn as much as we could about Rocky Flats, because we felt it did have a public health impact on the people of Jefferson County. We also were finally allowed as a department to do something at Rocky Flats. After a petitioning for a number of years trying to get involved with what was going on at Rocky Flats, we finally were allowed to do the restaurant inspections of their canteen at Rocky Flats, but we're told that anything else was really beyond our scope of understanding. To some degree, they were right. I am not a nuclear scientist. I am not an expert in radiological impacts on public health, and so we have been watching closely what was going on. We did get involved with doing some work. We actually now are again working and doing some sampling to see what is going on in the soil around Rocky Flats, but for the most part, both the attorney for the county and the attorney for the state have told us that this is not our job, this is the federal and the state health department's job to deal with Rocky Flats. So for a number of years, we basically backed off. And any of you who thought you were coming to see someone courageous, I am not courageous. We really have not been very active, probably not as active as we should have been, although as I mentioned every time we tried, we were told it wasn't our business. Until about a year ago, I was being interviewed on something that was totally unrelated to Rocky Flats by Rick Salinger on the channel CBS News. And as they were closing down and as they began to put away their cameras, he said, "Is there anything else going on in Jefferson County?" And I said, "Well, you know, there's this Rocky Flats thing. It keeps poking its head up, and now they're doing a lot of building in Rocky Flats in areas that before we had pretty much been told that they would not be doing building, and that we still have some concerns about what's going on there as a health department." So they got out their cameras again, and he interviewed me about Rocky Flats, and one of the questions he asked was, "Would you buy a house next to Rocky Flats?" And the most courageous thing I guess I have ever done is said, "No, I would not buy a house near Rocky Flats, either for myself or for my children. I still feel that we don't have all of the information, or at least we have not been told the truth about all the information around Rocky Flats." Well, that started a firestorm of both, on one side, people calling me a hero, on the other side, people saying that I was despicable. The State Health Department director called me irresponsible, and a number of other things. And there was an editorial in the paper that basically said I was I can't remember, the general of the whining brigade or something. So I wrote a response, and since then it's been sort of going back and forth, wondering about what are my thoughts and what are the health department's stand on Rocky Flats. I have to stand here before you and say that I do not speak for the county commissioners. The county commissioners, however, have never threatened me with a loss of job or anything. They have always been very supportive. They have not in any way come out against me for any of the comments that I have made. They did, however, finally say, "You know, every time you speak in public or you speak on the radio or television, you say you're speaking for yourself, you're not speaking for the health department or for the county, but nobody believes that. So you may as well just say, I am the director of the health department for Jefferson County, and here's what I believe." So, although I will tell you again, I'm not speaking on behalf of the county, a lot of people wouldn't care what I had to say if I wasn't the director of the county health department, so I understand that. What we have been discussing since that time, and that continues to come back, is what exactly is my position. So again, not as a courageous person, let me tell you, I'm really in the middle. And what I say by that is, and I have always told people, I really don't know how dangerous Rocky Flats is. We have done numerous studies. There have been, thousands of man-hours spent on doing samples of the soil around Rocky Flats. Studies have come out both from the State Health Department and from the Department of Energy and from the EPA, and now from Fish and Wildlife, and a number saying now that everything is safe. But I also have read books like Full Body Burden and The Ambushed Grand Jury, and I have read a number of articles by Dr. Johnson and by others who also have great credentials and who have impeccable remarkable credibility for their side of the story, which is that there is a real concern about what is going on at Rocky Flats. My position now has been that we really need to get an independent review of all of the studies that have been done at Rocky Flats. I'm not sure, I know I disagree with some of my colleagues here, on whether doing another health study or doing more sampling would really be all that helpful. I think we have rooms full of evidence, but that the evidence has been given to us in a way that I do not trust. If I learned anything from my training in getting my master's in public health, what we did over and over again was take articles and rip them apart, finding the problems with them. So I am very doubting. I question everything, as my wife and children will tell you. And I am very big on what is called epistemology. How do you get to the truth? I do not. Reading a new book by Michael Lewis, the one who has written a number of books, and in the book he talks about the terrible problems they're having at Hanford up in Washington State and the tremendous amount of contamination that they have found there, both of hazardous wastes and of nuclear waste. And then in sort of an aside, he says, Rocky Flats was cleaned up under budget and before, under the time it was estimated, and they were given rewards for how quickly they cleaned it up. And that's all he says about Rocky Flats. And I've tried to find how can I get in touch with him, because for somebody who is an investigative journalist who writes and investigates, it seems like he has taken at face value that one place was cleaned up excellently while using the same sorts of people and the same sorts of methods. They're having huge problems at Hanford. And I wish I could get him to review and look at some of the information we have around Rocky Flats, because I don't take at face value that it has been cleaned up the way they say it has. To me personally, and again, I'm not speaking for the county commissioners or for the county, but it seems too convenient that they were able to clean this so cheaply and so quickly when the original estimates were so much different than what has actually happened. Also, they have not cleaned at all the surrounding refuge. They just basically cleaned where the buildings were. And so all of the contamination that was there continues to be there in the property where they are not cleaned. And there are numerous studies agreed on both sides, not just the one side, but both sides have agreed that studies have shown that contamination has gotten off of the refuge into the property around the refuge. Rocky Flats never should have been built there in the first place. They used wind measurements from out at Stapleton, which showed that the wind was blowing one direction, and used those for here at Rocky Flats, whereas the wind blows completely in the opposite direction. So they built this 16 miles from a large metropolitan area with the prevailing winds blowing straight down across Rocky Flats and into Denver, based on faulty information from Stapleton, where the winds tended to blow more in the northern direction. Had they originally really reviewed that and understood that, I am told they never would have built there in the first place. Also, as you go back and look at the records, and it's interesting, once my name got out there, I have been getting calls almost on a weekly basis, sometimes on a daily basis, from people who want to tell me about their work experience at Rocky Flats. And it's interesting how you can read articles or books actually from both sides. Some people who worked out there and still support that it was a wonderful place and doing a wonderful thing. But I'm getting calls from all sorts of people saying, nobody ever asked me, but I can tell you where things are buried, what we were doing. I had one gentleman who called and said, I was applying to do a soil sample out there, and I had this very scientific grid with random places where we were going to do this, and I applied to do the soil sampling out there, and got called from somebody at Rocky Flats saying, this is too expensive, we've got a guy here with a bucket and a shovel, we're going to do our own sampling. So as I hear people talk about their work at Rocky Flats, and as I read particularly about the way the Department of Energy and before them the Atomic Energy Commission worked out there, and again, almost everybody, you can find some who disagree, but almost everybody agrees that the culture out there was not concerned at all about safety of the workers or about safety of the public health around. They were focused completely on making the triggers for the atomic bombs, particularly through the 50s and 60s when we were in the Cold War. Some of you are young enough not to know what it was like living in the 50s and 60s, but I went to school when we used to do the drills where we would hide under our desks and we would, prepare for the atomic bomb coming. We really did believe that Russia was going to send an atomic bomb, particularly around the Cuban crisis, all of those things. So I can understand the patriotism and the concern about the health or the safety of our country and the push to make sure that we had atomic weapons or that we were not getting left behind by the Russians. But to me, the ends don't justify the means. And the fact that they had great intent, but were lying to the public and lying to the workers or hiding things, maybe I shouldn't use the word lying, but hiding things from the workers and were focused totally on the patriotism. And I use that in the nicest way, because as I reviewed it, I think there were some real patriots, but I also think there were some real greedy people who were out there just making as much money as they could and didn't really care either way, as long as they were making money. And so as I have reviewed the history of Rocky Flats, and I have looked at both the work of the contractors out there, and as I have looked at the work of the government out there, I really hold the Department of Energy and the Atomic Energy Commission responsible for what was going on out there, because constantly they were pushing for more and more production with less and less control and less safety for both the workers and for the public. I think now we are in a really difficult position because we have essentially been told that this is a safe place. Those of us who still have questions about it have been told that we are barking up the wrong tree, and that it's going to be very, very difficult to get funding to do any more testing. It's going to be difficult to get testing to even review the studies that have been done out there. We have been told essentially that the parkway is going to go in, but we really can't fight that much anymore. I do have a little bit of hope, though. It was interesting to me what kind of response happened with the recent application for fracking under Rocky Flats, and how that seemed to get the attention of a lot of people who really had sort of ignored what was going on at Rocky Flats, that it just makes no sense to be digging under the ground. To me, it makes a whole lot more sense to be digging a mile under the ground and fracking than it does to be digging out the ground on the top to put in a new road. But don't tell my commission what I said. I do think that we in Jefferson County have long had a history of being more concerned about development, economic development, and getting things built than we have about public health. That probably will continue. Public health has never, almost in the history of the world, unless you're having a black plague or something, risen to the level of importance as that industry has. So we will continue to fight. We'll continue to try to get more information. The things I am trying to get at this point is I would like to get an independent review of all of the data that we have. I'm happy to work with those that are trying to get more studies done. The problem with studies, and I'll just mention this from an epidemiologic point of view, one of the most difficult things there is to characterize is what is called a cancer cluster. The odds of us getting cancer in this room are very high in the United States. And so, depending on who you talk to, 1 out of 8 of us, 1 out and sort of, reverse engineer how you got that cancer is extremely difficult to do. Even when you have a group of people that are in a cluster trying to figure out what caused this cancer is very, very difficult. In fact, a few years ago, the Centers for Disease Control and Prevention in Atlanta said that they were not going to do any more cancer cluster investigations because they were just so non-productive that it was very, very difficult, very, very expensive, and very, very hard to try to find a source. We have had a couple of those here in Jefferson County. Some of you may remember the concern about the radiation coming off of Lookout Mountain when they were talking about changing the antennas up there. That got very personal for me because we were in a building right at the bottom of Lookout Mountain, and one of our esteemed colleagues came down with a brain tumor, and I came down with a brain tumor. And I was yet still out there arguing that we have no evidence that it's the radiation coming off of Lookout Mountain. At that time, I was called a whore of industry. So at least I may not have gotten fired, but I am making some good enemies. But again, what I have tried to do in all of these cases is try to find the evidence, look at the evidence, and I have been told even by one of my Board of Health members that I am using my emotions more around Rocky Flats than I am my scientific expertise. I don't believe that. I think there is evidence, good evidence, particularly when you read a book like Full Body Burden, or especially the one about the ambushed grand jury, which is hard to find anymore these days. But when you read about the, dare I say, collusion or conspiracy between the Department of Justice and the Department of Energy, and the work that they were doing behind the scene, even while the grand jury was trying to come to their conclusions, that there seems to be a huge interest in the federal government not to have Rocky Flats be a source of concern. The other point that I think is interesting to look at is they are using Rocky Flats as their model picture of how they are cleaning up nuclear arsenals or nuclear manufacturing areas, and they want to be able to do that. They have about 17 areas around the country where there was nuclear contamination and hazardous waste contamination from our work during the Cold War. If they can get us to buy that Rocky Flats is clean and we can walk and hike and bike out there, it's going to save them billions of dollars in cleaning up at Hanford and Savannah River and some of the other places, where they can now use this as a model instead of some of the demands that have been made by those who do not feel this has been cleaned up. Sort of got off track there for a second. I was talking about cancer clusters, and I have found in my years of life that I cannot read people's motives. But again, it just seems so convenient, and I believe some of them realize that if Rocky Flats continues to cause cancer cases, nobody will ever be able to prove it. I personally believe, and the numbers they come up with are 1 in a million people who go out onto the property in Rocky Flats may get exposed to plutonium to a level that they may get a cancer. You will never be able to prove that they got that cancer from Rocky Flats. However, there is some work that is being done that is at the University of Denver, where they are able to go and find some of the source material in a tumor and are able to identify where that came from. So maybe in the future we will have a better Rocky Flats, so it really doesn't matter if we go ahead and let people do whatever they want out there. Maybe I've watched too many movies, maybe I am too diabolical in my own thinking, but I do believe that people realize that even if we do have cases coming off of Rocky Flats, or even living around Rocky Flats, it's going to be very, very difficult to prove that that cancer cluster or that particular action. I've spoken a bit. I don't know if there are other thoughts that you may have. I see some hands. Maybe we can take some hands and some questions. Again, I am not speaking for my commissioners, but I would be happy to speak. Yes. Yes.
Well, I'm curious about the cluster issue, because if you were to look at cancer diagnosis in the target area and the number of people that were being diagnosed and the type of cancer that was being diagnosed was much higher than what the statistics should show in the average population, wouldn't that be enough causation to launch further research into the issue?
Did everyone hear the question?
No.
Basically, the question was, if you were able to find a group that were having cancer in a particular geographic area that was near to a source or a questionable source, couldn't you prove that if that was higher than what the rest of the population was, that that was the source of the cancer? Is that fair?
Yeah, particularly for the types of cancer associated
Yeah.
with those kinds of toxin exposures.
That's one of my concerns about some of the studies that have been done around Rocky Flats is there, particularly more recently, the one that was done from Metro State University, there were a number of conditions and cancers that were found to be elevated, but they're not necessarily the kind of things that you would expect from an alpha-emitting nuclear particle like plutonium. So the first thing is you have to find a number of cases that are related to a biologically known outcome from that source. And in Colorado, in the United States, we have such a mobile population that it's hard to find people who have lived close to an area for 20 years, which is usually 10 to 20 years is the latency period between exposure and coming down with the cancer, that have been there for that period of time and have come down with those kinds of cancers. It's very difficult. Even as I read through full body burden, a number of the conditions that were talked about were not necessarily the kind of cancers that you would expect. Having said all that, there's a lot of things we don't know about plutonium and exposure to plutonium, and whether some of these cancers that we weren't expecting, there are some very rare heart cancers and things like that, that may actually be caused by plutonium that we are just now finding out. So when you add all of those unknowns, the length of time there, the air exposure, it's impossible to retroactively figure out the exposure to somebody. You can say, well, you lived there for 20 years. We don't know how much dust blew up there. We don't know what other kinds of chemicals they were exposed to, where they worked, those kinds of things. So quite often what they do is they do a worker study, and they look at the workers who are working with that. And they did that at Rocky Flats. And I don't remember the exact numbers, but one of the cancers was found to be 8 times increased and one was 3 times increased. And then the bottom line was that overall, the workers at Rocky Flats were healthier than the people around Rocky Flats. There's also a thing called a healthy worker effect, which means that if you have a job, it means you are healthy enough to get that job and to be there and to work all that time. And so all of these unknowns just make it very, very difficult to trace it back. If we were able to do what they're trying to do at the University of Denver and find the plutonium that has the marker that says it came from Rocky Flats, that would be wonderful. Right now, though, you basically have to get the person after they're dead to get the cancer, which kind of is a little too late for them. So it's very, very complex. I saw a hand over here, and then we'll come back over here. Is there some? Yes. I'm pointing way over here to a lady in a red sweater.
The plutonium, if it is found in a tumor or even in ashes, I understand. So Julian comes for a meeting in January, yeah, he has a lab where he was working, that he has access to. He is a forensic chemist. He's a person to learn from.
Yes, Dr. Ketterer is the one I was referencing, who works at the University of Denver, who has a laboratory where he is. I don't know that even he would perfected to where but he is working on that. Sasha is also working.
Right now, I hear it's bigger, but, anyway, so I was just curious, if there's any comments on that.
The question was, aren't they working with data and trying to come up with models to use the data and find models that help to figure out causes and things like that? The answer is yes. But the models are based on assumptions and based on, you can get a number of different models with different assumptions that show different things. That is not yet a pure science, even finding modeling. Most recently, you may have heard that we have a place in Jefferson County where ethylene oxide is blowing off of a industrial place. And it's all based on modeling. They're saying there's a concern that there's going to be an increased rate of cancers. And as we've looked at the data from the cancer registry, there is no increase. And so trying to get the models to match what's going on in real life is sometimes very difficult. But I'm guessing we'll get better and better at that. Yes. Yes.
I can't see you.
I'm pointing to you, the one who just said I can't see you.
Okay, Dr. Michael Ketterer is a person, we are going to have him here in January. He has ways that he can identify weapons-grade plutonium. He can identify the isotopes. So he is able to pinpoint the source of the plutonium if it is found in the tumor or even in ashes, I understand. So tune in, come to our meeting in January, yeah, he has a lab where he was working, that he has access to. He is a forensic chemist. He's a person to learn from.
Yes, Dr. Ketterer is the one I was referencing who works at the University of Denver, who has a laboratory where he is. I don't know that even he would say yet that he's got it perfected to where but he is working on that. Sasha is also working with putting together a proposal, as is Randy Stafford, to get Dr. Ketterer to do more studies, and you may want to say some words on that later, but that I would certainly come and listen to it. Yes, sir.
I'm unusual in that I did buy a house in back home in Rocky Flats. I did this only after a great deal of care in measuring many things. So I'm concerned. There are two populations that were basically affected by Rocky Flats. There are people who live downwind. Well, had 903 was in operation, and who knows what happened to them. Well, we have some idea. However, for the vast number of people who live around Rocky Flats now, they are affected only by what is left over in the soil and what is blowing off of Rocky Flats. Do you not trust the data that was measured about the radiation levels from the soil? I may remind you that it's very hard to hide radiation, right? It can be detected even from orbit. That's how, for example, the blast off of ICBMs is detected among everything. So it's not as if the radiation can be hidden. It can be measured. Do you dispute what has been measured by the DOE back in the 80s and the 90s on Rocky Flats and around Rocky Flats?
Please repeat the question.
The question was, well, the statement first was, he has bought a home near Rocky Flats, and he did so after a great deal of study, and am I questioning the data that was collected in the 80s and 90s about the level of radiation in the soil around Rocky Flats and coming off of Rocky Flats? I will fall back on my question. I don't know how safe it is to live around Rocky Flats. I will say I do not trust the conclusions that were brought out from the studies by the Department of Energy in the 1980s and 1990s. There are tests that have been done by people who are, I'm saying there's two sides. There are people who have studied it independently, and there are studies that have been done by the federal government that are widely different. And I, again, have a difficult time reading through the millions of pages and studies, not being a nuclear scientist, and figuring out exactly what is true as far as the exposure that is still going to be common for people who live around Rocky Flats. Having said that, I will tell you that one of the individuals who called me and talked to me did some testing for the federal government at Los Alamos, testing the soil down there for the Department of Energy. And the way he described it, and again, I'm a messenger, not the one who said this, but he said we would do a soil study and we would be told after they tested it that wasn't a good soil sample. So we'd do another one over a few feet and would be told that wasn't a good sample. Then we'd do it finally on the fifth one, would be told that was a good sample. And it showed nothing. I do know from people who are out there that the testing of some of the tests were questionable. I don't know which ones were questionable. And so again, my comment is I don't trust the Department of Energy. I don't trust the way they worked with the population around there. I don't trust the way they worked with their workers out there. I think there is great evidence that is almost uncontested by anybody that they were much more interested in getting the production out of Rocky Flats than they were about the health of the people around Rocky Flats or the people working at Rocky Flats. And I don't trust the data. I would love to have somebody independent who really knows what they're doing look at that and give us some, it would give me a better footing on which to say I trust this. One of the problems is trying to find somebody who's really independent. Because many of the nuclear scientists and nuclear programs around the country are funded by the Department of Energy. So finding somebody who's truly independent is difficult and may actually have to be an international group. But I guess my answer to you is no, I don't trust the Department of Energy or the studies that they did in the 80s and 90s. Back row.
Number one, I used to go to the health advisory panel meetings for years. And consequently, they sent my sister and I, who are with the Environmental Information Network, they sent us to Washington, D.C. for a conference on how they come up with their little theories. And we met one of the guys on a subway that were going to the conference, and they said, oh, you're talking about this gentleman is really, like I said, his name is Paul Bowler, and he worked with cameras, radiological assessment, RAC. And he is known as Mr. Risk Assessment because he can give you whatever outcome you want. And DOE loves that kind of stuff. I'm saying that in the case of the missing brain with Don Gable, when he died, he worked at Rocky Flats, where they took the brain cancer out, it left an indentation the size of the pipe that his head was next to at work. But when he died, they stole his brain because it was missing. They could never find it. And the Department of Energy has proved to be liars and bad neighbors for many years. And here you, and I'm sorry, I really like you, I've seen you many, many times through the years. And here you say that Jefferson County has never been able to be at the table. That is bullshit. You should have been there to protect us. And when they're excavating out there, that's when we should have some air monitoring done, at least by our own county health department. I applaud you for coming out and speaking about it, but quite frankly, it's almost a little too late. We still have no air monitors out there at all. What happened to all that money that the state got, and probably the county got some too, when John Lipsky raided that plant? They paid what, 50 or 60,000, John? Million?
8 million.
Yeah, so where'd all that money go? We need some money for air monitoring. And I, for one, would feel better when they had the batch burning at Rocky smoke filled up our carport and you would smell it. Our rattler pegged out, and the Channel 7 people could see it. I can't hear anybody even thinking that, well, we don't know this is from Rocky Flat. But good for you for coming out.
Well, thank you. I appreciate your comments. I remember you from the Health Advisory Panel,
I'm sure you do.
and you have not lost any of your spunk. I appreciate that.
It's a miracle.
So thank you. When I said that, let me say a couple things. We have been told, in fact, we have tried to sue, and we've tried to get involved, and have been told by the judge that we do not have standing. So when we have tried to do some of those things, we have been told not to. We have also, as I've said numerous times, been told this is not a county thing, this is the state health department's doing all of the public health, the Department of Energy, you do not have standing here. I tried to say, I apologize that we have not been more active, but also our department does not have the expertise that is necessary. We don't have nuclear scientists in Jefferson County Health Department. We have epidemiologists, we have reviewed a number of things, we have tried to get involved. We are involved now in the testing that's going on. But again, the standing, the ones who really have the authority with the federal government, it has always been the state health department.
And those guys are a bunch of liars.
I will not say anything about that, but thank you. The red jacket, and then I'll come to you, sir.
Yeah, thank you so much for being here. I really appreciate your humility and your honesty, and I full on buy it that you're here because you feel like you've got to make this better. And as a member of the community who's affected by this, I feel very enthused by that. On the other hand, to tie together your lack of trust in the data and some of the people in this audience and their personal experience and their, I guess, dissatisfaction with the way Jeffco has handled the issue, I've got two questions. I mean, one is, can you just clarify for this group, what is your remit in terms of public health for Jeffco? So what do you have as your responsibility? And given that remit, what are the steps that you're taking to ensure the public health of our community? Because that is, as constituents of yours, that is what we're counting on you for. So without loading that with any expectation, I'm just thinking it might be helpful to clarify that.
The state statute, which is the one that defines what a local public health department is supposed to do, in broad terms, we are to protect the health of the people in the geographical area that is Jefferson County. We do that in a number of ways. We do that through water monitoring, we do that through restaurant inspections, we do that through clinics, we do that through home visitation, we do that through a number of different things. After Dr. Carl Johnson was so involved in Rocky Flats, which a number of people said, why haven't you all been doing what Dr. Johnson did? After that, we were, as I have mentioned several times, we were cut out from being everything we do is we're an extension of the state health department in the local county. So all of our powers come from the state health department. So we were told around Rocky Flats, this is the state health department is stepping in, we're working with the federal government, we're taking care of this. Jefferson County Health Department is not to be involved here, except for inspecting their restaurants or their canteen. As I have said, perhaps we should have been more aggressive, perhaps we should have been doing more, as a number of you have said. Every time we tried, we were told, no, this is not something you have standing for, this is not something you can be doing, you do not have the authority to be doing this. It is the state health department now that's taking over. As I said, we also do not have on our staff the kind of people that Dr. Sites in places, he had the expertise. We have not had the expertise in our department since that time, mainly because we were told that's not to be our business. So again, you know, if it's a mea culpa, I apologize for that, but every time we have tried, we have run into a I am not an expert on Chernobyl. I have read what they're doing there now. They basically have it's almost no man's land, at least around the area there. I have read some about some of the animals and some of the mutations and things that they have there. Their exposure, I think by all accounts, was much greater than we have here at Rocky Flats, and was much more damaging to both the area and to the population around there. So I'm not sure it's a good comparison to what's going on at Rocky Flats. Still, however, I would say that we have to look at a number of places, 3 Mile Island and Rocky Flats and various places where there has been exposure that, again, I think raises red flags as to what we are doing with it. Yes. I see the back row over here.
Well, I actually would like to thank you for being here. We really do appreciate hearing from you, and I'm glad to see you in person. One of the thoughts I had was the cleanup happened about 3 feet down. Am I correct? 3 feet down? Okay, so after that, the plutonium and the testing was about 24 feet down. So we pretty much left this as uncleaned area, and this is the 3 feet. So if you scrape the top up, and like, let's say, for example, you dig a foundation, which is maybe 24 feet, we don't have testing for that. We've lost our testing. So the more that the dirt and the dust starts getting stirred up, basically, where's the studies for the 24 feet down now? And what's happening with that? And, that's what I'm kind of wondering, where we have 2,400 new homes going in. That's changed data. We have roads that will change data. We have, the animals digging down has changed, or the worms, so to speak, the earthworms have moved into the earth. So that's the question I have proposed to you is, what about those homes that have gone in on that?
Rocky Flats is basically divided into 2 major areas. One was the area around where most of the buildings and most of the work was done, building 771 and some of those. Those have been essentially buried, and those are supposed to be nobody ever goes there again, or they're off limits. The area where the hiking and biking and trails are is in the refuge, or the area that was bought, the open space that was bought around that as a buffer, particularly after the lawsuit that ended up with the $9 million settlement. Theoretically, that the deepest area is off limits. The other area has theoretically mainly been where the wind has blown it, or the smoke is blowing, or we came off the pads and things like that, into the dirt that is the topsoil, or the most exposure is in the topsoil there, However, I have also had people call me and say, we buried a bunch of drums over on this hill over here that nobody ever knew we were doing. So again, I don't know where all of that is. On top of that, even the area that is supposed to be off limits now, when we had the huge rains in 2013, there was water runoff that showed that the soil there was being washed away. So I would say I don't believe there's any safe place out there, and how much exposure there is to various places. There are doing some testing, and the testing will continue. But I personally don't believe there's a whole lot way underground, like down where they're doing fracking. I don't think they're going to be getting into the plutonium. But in that area where they buried those buildings, it's probably 20, 30 feet deep, but you probably will still find it. In the other areas, it's mainly in the dust that you're getting off the top of that. So there's no good place out there, but there's some places that are a lot worse than others. Yes, sir, right here in front.
I wanted to thank you for coming out here. So despite whatever negative comments you may receive, please know that you being here is truly appreciated, because regardless of that, we should be responsible for making sure our government is taking charge for our health. So the fact that you're here, I truly thank you and appreciate it, and thank you for sharing this information. The question I do have for you is, are you familiar with the wells that are out there that they're testing and filtering the water? Supposedly 11 of the 14 wells in the wildlife refuge.
I am aware of those. I've seen some of the testing that comes from some of those from some of those wells. Yes.
What have you seen as far as the data on those wells?
For the most part, they are below the level that is acceptable. There have been a couple of them that have actually been higher than acceptable. But the testing continues and it varies from month to month, yeah.
Part of it, not understanding, but I thought I heard you state that they're also filtering that water due to contamination. Is that accurate?
I did not say anything about filtering the
Not
water.
you, the news.
Oh.
What I saw on Channel 9.
I am unaware of any water that's being filtered to try to make it safe coming off.
And my last question, since there are so many questions, are you looking at radioisotopes in the water in Denver or anywhere in San Diego and so forth that is actually coming out of the test? Because there are tests showing radioactive isotopes in the water.
The Stanley Lake, the dirt or the sort of on the floor of Stanley Lake, it has tested positive. I am unaware of the testing in Stanley Lake showing positive. I know that there were a number of runoffs that occurred where not just radioactive material, but actually other hazardous waste got into the water system. But I do not know right now what's going on in the water in Stanley Lake.
Not just Stanley Lake, there's just in general, because according to the testing from 2017, we have higher than federal averages across all states. For example, granted, we have a lot of minerals in Colorado, but we're way above what 50 other states, 49 other states, or lower, 48. What are your thoughts on that? And is there any way to filter that and gumption, or work with it?
I know that the cities that are using Stanley Lake water or any of the water, most of the water that comes out of Rocky Flats is not being used for water sources. The water that is being used around there is being filtered and is being tested and being checked very stringently by the water, the systems around there. Colorado is a dangerous place radiologically. We have higher radon levels, we have uranium, we have a number of, we have higher exposure because we're at higher altitude. So again, that goes back to one of my previous comments, trying to figure out if I got a cancer, exactly where I got it living in Colorado is very difficult. Dr. Ketterer's work shows some promise.
I'm not concerned with that. Cancer, unfortunately, is too complex, too many variables involved, so no one's going to pinpoint that in our lifetimes. That being said, I'm just curious to know the quality of our water, the one issue that I have. The quality of our water, is it equivalent to what is across the rest of the United States? Or do we have a higher concern that isn't possibly being addressed properly, and it's just, it is what it is?
From my understanding, our water system is as safe as it is anywhere in the country. But again, that's the state, that's not individual places. There are some places that have very high, fluoride and various things that they do try to. All of the public water systems bring it down within the acceptable levels for all of those things. But I would say our water system is as safe as any in the country and tastes a whole lot better than a lot of places. Again, I'm sorry I haven't been able to answer. Pardon? One more question, sir.
Doctor, thank you again for being here. I just wanted to ask, you said that the Jefferson County Public Health Department doesn't have the expertise to evaluate the safety of Rocky Flats. What about our Colorado State government? Does the Colorado State Department of Public Health have the expertise, the personnel, with the experience and the knowledge to be able to evaluate?
I believe that right now, the State Health Department has much better expertise than they did in the 90s when I first moved here. I'm going to get in trouble here again. When I first moved here and when I went to the health advisory panel and committees and things like that, I got a sense that oftentimes our department was being played by the Department of Energy and the federal agencies, and that they were, I hate to say being bought off, but a lot of the money that came into the State Health Department, I think, tended to make That's probably all I should say.